Thank you all for coming. I'm Richard Amerling, President-elect of the AAPS. Thank you, everybody, for being here. I want to thank particularly also the program committee. Where are you guys? Melinda, Marilyn, Bob, did great work. Thank you very much. I also want to just have a short moment of silence for our departed past president, our friend, our mentor, our colleague, Dr. George Watson. He was truly an American hero, and he is sorely missed. Thank you. Now, I came of age during the 60s. I was actually at the original Woodstock. Rode up there by motorcycle with my brother, and we got stopped by the police because we had long hair and beards. It was that's how I came up. And back in 1967, the Beatles came out with Sgt. Pepper. How many of you remember that incredible moment in history? And that was a concept album. That was one of the first of the concept albums. So I thought that, and by the way, you're going to hear some of the songs from that album tonight out in the courtyard during the reception. Roger Greenwood and I are going to try to pull off a few of those songs for you. So this is a concept meeting, and I want to just give you an overview of how this meeting is going to go and give you what the thinking was behind it. And let me just start by saying that though we all decry things like single-payer healthcare, a single-payer system need not be necessarily tyrannical. I went to medical school in Belgium. They had a single-payer system in effect, and it was an extremely good, fair, equitable system, and the major reason was there was no direct third-party payment of physicians, so that the interaction between the payer was with the patient directly, not with the doctor. So there was really no opportunity for the payers to control the way we practice medicine back there. And even if you look at early Medicare, there was non-interference from the government, and people bought into Medicare because they were promised that it would provide a non-interference kind of third-party system. And of course, we know that it evolved very differently from that. It became quite tyrannical, and now people are having to opt out more and more. So tyranny comes when the payers insert themselves between the doctor and the patient. So with this third-party payment system comes the opportunity for them to control what we do. And we are, in fact, witnessing now the transformation of medicine from an art practice for the benefit of individuals to a malignant version of public health practiced for the benefit of government bureaucrats, politicians, and other special interests. So think about who pushed for Obamacare, the federal takeover of healthcare. Well, obviously the Social Democrats did because they wanted to get more and more power over the individual and to consolidate their electoral base, but also big labor. They were big fans and they pushed heavily for this. Why? Because a big part of Obamacare was Medicaid expansion, and a lot of Medicaid money flows directly into the SEIU and their 1199 affiliates, so the healthcare workers. The American Medical Association, we've been through this. We know why they were involved. They get lots of revenue from the government. Hospitals saw this as a golden opportunity to increase revenue. Big insurance, they're getting a guaranteed pool of new subscribers with premiums guaranteed by the taxpayer and the ability to raise their premiums and raise their deductibles. Okay, so this was a tremendous boondoggle for the insurance companies who backed Obamacare. And let's not forget pharma, okay? The Pharmacological Research and Manufacturing Association, which is in effect a cartel of 30 or 40 big pharmaceutical companies, pushed for Obamacare. Billy Towson, their representative, was in the White House negotiating all kinds of deals. And how are they going to benefit? Well, look at all these new people who they're going to be able to sell their drugs to. And how are they going to sell their drugs? We're going to do it for them. We're going to be prescribing drugs for them based on the official regimented government medical guidelines. Of course, big information technology, huge beneficiary, mandated electronic health records, et cetera. So we have now the perfect storm, the complete government takeover of the healthcare system and the unfettered rise of crony capitalism. So it's not purely socialized healthcare, it is really crony capitalism, which is very closely related, if not identical, to the sort of corporate fascism that was practiced in Italy leading up to World War II. Now, we now have we're at a point of time where the practice of medicine is itself being centrally planned. It is not just that they are paying for healthcare, they are actually going to try to impose their version of healthcare on us through various procedures and processes, and that is really going to be the subject matter of this meeting. We're going to discuss how this is going to be done. The consequences of this are going to be disastrous for our patients if we don't stand up to it. So the cornerstone of the effort to control us is evidence-based medicine. So one of the early talks we're going to have is going to be Twyla Braze, who, in addition to her incredible work as a patient advocate, she is an authority, I believe, on evidence-based medicine. In fact, I came to see her name first in an article that she wrote some years ago, a very extensive article on evidence-based medicine where she dissects it. So I asked her to give a talk on that. Chris Held, who's been an outspoken critic of Obamacare, is going to then show us how Obamacare is going to directly affect patients, really harm them. And then we will go on through various modalities. Tomorrow is going to be about how evidence-based medicine get turned into guidelines, practice guidelines, then are enforced through various mechanisms such as payment for performance. My colleague from England and the other half of my musical duo is going to talk about how payment for performance actually works in the UK, where they've been doing it for many years. And then we're going to talk about different diseases that are being actively managed by the third parties, being pushed by the interested parties for us to practice a certain type of medicine, over-prescribing of statins, for example, over-prescribing of psychiatric drugs. Just saw an article today about how about 90,000 emergency room visits are linked to reactions to psychiatric drugs. I mean, these are major players. So you will see how remaining independent as physicians is no longer just a theoretical issue. It is a practical issue of deadly import to our patients. If we are not able to remain independent and resist the standardized version of healthcare, which is nothing more than public health, being imposed on our patients through all these mechanisms, our patients are going to suffer grievously.